My name is Desmond Nji A. I am the founding president of the Progressing Association Cameroon, PASS, which works to promote girls and youths' sexual and reproductive health and rights. I was selected this year, 2015, as a young fellow of the Women Delivers Young Leaders program. I also hold the office of First Vice National President of the Cameroon Youth Network, which works with UNICEF Cameroon to promote girls and youths' sexual and reproductive health and rights. I live in a community where many are a youth and a girl that still is least aware of his or her sexual and reproductive health and rights, as well as family planning. But what are these concepts?
Sexual and reproductive health and rights has 4 concepts: sexual health, reproductive health, sexual rights, and reproductive rights.
Sexual health refers to the sound physical, emotional, psychological, and social state of an individual in relation to his or her ability to practice pleasurable safe sex.
World Health Organization says that reproductive health is concerned with the rights of both men and women to obtain information and have access to effective, appropriate, and affordable birth control methods of their choice, and access to good health care facilities for women to help them through gestation and childbirth. Sexual rights deals primarily with the ability to freely make sexual decisions, enjoy pleasurable safe sex, and right to sexual expression. Family planning on its part is the ability of an individual or a couple to choose and procreate the desired number of children, including the spacing and timing of birth. In Cameroon, according to UNFPA 2012 statistics, 86.6% of youth neither have sufficient knowledge on reproductive services, facilities and needs, nor adequate information on their sexual and reproductive health and rights. 60% of girls and women of childbearing age do not have access to effective contraceptive methods. Pregnancy and childbirth is consequently the #1 killer for girls between 15 and 19. This is enough reason to take global commitments and ensure local actions.
Global commitments are the obligations that are adopted worldwide, predominantly in international fora like the International Conference on Family Planning, which set the stage for all stakeholders to actually implement local actions in the grassroots. The theme focuses on transforming global plans into local realities.
As part of global commitments to promote women's sexual rights, the 1995 Beijing Platform for Action agreed that women's rights include the right to freely and without coercion, violence or discrimination, have control over and take decisions concerning their own sexuality and sexual and reproductive health.
As part of my local actions to implement some global commitments, I was trained in Nairobi, Kenya, sponsored by UNICEF and MTV, in the program Sugar program, to use communication tools to sensitize and educate my peers. Back in Cameroon between 2012 and now, I have been using the radio and the TV to sensitize my peers on their sexual and reproductive health and rights. Secondly, I give voluntary counseling on individual and group basis to youth in the Cameroon National Association for Family Welfare, which is a member of the International Planned Parenthood Federation. I am also project director of the project titled Help a Girl Save the Society, which is training peer educators on their sexual and reproductive health.
To improve on taking local actions on family planning and sexual and reproductive health and rights after global commitments, more youth empowerment in global fora is required so as to furnish them with the skills to take actions at local levels. More local peer educators and young communicators should be trained. Youth-friendly centers should be opened to attract more youth for counseling.